As we officially enter the fall season, Board of Health Director Stacy Lane has some important information for what to do to stay healthy and safe during the fall and winter seasons.
Here we are on this beautiful fall day, but with the beginning of fall marks the beginning of flu, cold, and virus season. So I want to give you a few tips on how to prevent these illnesses and how to stay healthy. So first, I'm going to talk about the flu. I think we all are very familiar with the flu, and we have flu vaccines that are available. We offer them every fall, and they're available here at the health department. Right now, currently, we are offering clinics at the senior center and senior housing, and we have some small clinics here at Town Hall, and we actually offer home visits for those who are homebound. There are two different doses or two different types of vaccine. One is the regular quadrivalent vaccine that is for our ages, adult ages, and then we have the senior dose vaccine that is a little bit of a stronger vaccine, has a stronger antigen to kind of elicit a response, a better immune response for people that for older individuals over the age of 65 that may need a little booster to get that strong immune response. And fall's a perfect time to get this vaccine because it takes a couple of weeks to develop an immune response. So you want to get it now so you're protected for the winter season and get you in through the spring. So then another vaccine that we have, or we don't have but is available to help with viruses, is COVID vaccine. So there's a new COVID vaccine that is a new formulation for the strain that's currently going around right now. We hope to get it soon. We don't have it yet, but it is becoming available. It is available at pharmacies. So if you need one now, I suggest you get one as soon as possible. Again, it takes 2 weeks for that vaccine to work also. And then the third one, some people probably heard on the news a lot, is RSV. So RSV virus is, for most people, can be a mild virus, but for young children, for infants, premature babies, and for older individuals, it can be a very harsh illness. You can cause some serious consequences, and can be quite deadly for infants. So if you are 60 and over and you want protection from RSV, speak to your healthcare provider to see if you are a good candidate for that shot. And then people don't know, if you want to know what virus you have, if you're unsure and you're feeling sick and you want to know if you have COVID tests are now available again through the United States Postal Service. So if you go on to covid.gov/tests, you can order a test, 4 tests per household that will come delivered right to your door. And just if you want to know if you have COVID, because you still want to stay home if you're sick. Those guidelines are still in effect that you need to isolate at home for 5 days if you test positive and wear a mask for the remaining 5 days if you're feeling well enough to go out. And then the other tips that are the tips that don't change are wash your hands frequently, use hand sanitizer if you don't have access to a sink to be able to wash your hands, cough into your arm, stay at home if you're sick, especially if you have a fever or you're coughing, and again, wear a mask if you have to go out. If you were exposed to COVID, that's still, if you do have someone in your house that is a COVID case and you want to go out, you don't have to stay home. Back in the day, you had a quarantine. You're allowed to be out, but you have to wear a mask for 10 days and monitor yourself for symptoms. And then some of the other basic stuff, like I said, it's a beautiful fall day. Get out and walk, eat right, exercise, try to reduce stress in your life, and just stay healthy, Norwood.